Hello, I'm Dr. Roy Picard, and this video is primarily for the parents of a child who has been diagnosed with having tics or Tourette syndrome. I'm a licensed doctor of chiropractic in Shelby Township, Michigan, but what I utilize in my office is chiropractic neurology, functional endocrinology, nutrition, and brain-based therapies. Now, I became board eligible in chiropractic neurology back in 2006, and in 2008 I became a certified DAN doctor. Now, DAN refers to Defeat Autism Now, and I was certified through the Autism Research Institute. My specialized postgraduate training, along with my 22 plus years in practice, is really what allows me to effectively work with these kids to allow them to decrease and, in some situations, eliminate the tics without the use of any drugs. Now, whether we are talking about Tourette's or specifically tics, obviously we are not dealing with a life or death situation. However, to the child who has this, especially in severe cases, it may seem like a death sentence. My heart goes out to these kids and their families. I mean, let's face it, we all know how kids can be cruel, and adding this unwanted attention to a child can be devastating, even for adults who are afflicted. This problem can lead to social isolation and depression that can totally destroy an innocent child's life. Families are not only having to deal with their child coping with the stigma of the syndrome, but also the concern over the different medications sometimes recommended for severe cases. Typical and atypical neuroleptics, antipsychotics, antihypertensive, and stimulant medications often bring about a great deal of worry for the parents whose children have severe cases of Tourette's. Counseling can often benefit a child in their ability to handle the social misunderstanding, but nonetheless, they're still, at best, just learning coping skills. That's all they're being taught. And sure, in time, the neighborhood and the school may become, let's say, more understanding of what is going on, but sooner or later, the child leaves their comfortable school and neighborhood to go places, say shopping or out to eat or some form of entertainment. And then, depending upon the level of symptoms, the uneducated society reminds the child that they are different, and it is hopefully at this point in time that the child's coping skills can allow them to handle the unwanted attention. Now, unfortunately, there is only so much that a parent can shield from their child. The purpose of this video is to let you know that often there can be drugless types of care offered to help these kids. Obviously, when looking at tics or Tourette's, the main focus has to be centered on the brain. When studying the brain, you will eventually learn that the brain requires two things: stimulation and fuel. When the brain is not working properly and in full communication with all areas and different lobes, optimal physical, mental, social, behavioral, and academic performance is achieved. If one or more areas of the brain are not functioning to their optimal level, if they are not in sync with the rest of the brain, then what can occur are tics and other symptoms and comorbidities that are associated with Tourette's. I work to uncover the core issues as to what has led your child to their diagnosis or suspected diagnosis. Children with tics and Tourette's all show an imbalance in the brain known as a functional disconnection syndrome. It doesn't mean that there is anything broken with the brain or that surgery is required. It just refers to the fact that the brain is no longer in full communication with all areas or lobes. With the proper type of testing, it can be determined if one or more areas or lobes of the brain are not working in sync with the rest of the brain. Are there certain areas of the brain that can lead to tics? Well, absolutely. Specific activities and brain-based therapies to these out-of-sync areas of the brain can then be stimulated or exercised to become in sync with the rest of the brain, which is proven to decrease and, in some cases, eliminate the tics. Something else to consider is that when we are looking at brain function, it is extremely important to make sure that there is proper nutrition or fuel to the brain. Without proper fuel, the brain is going to fatigue, and this will lead to an increase in symptoms that your child is suffering with. With proper testing and analysis, an individual's body chemistry can be evaluated to determine if nutritional support is necessary to allow the brain maximum function. This part of the care, referred to as metabolic care, is achieved by specific questions and specific types of lab work. Understanding what nutritional support is required in the body will allow you to change your child's diet in order to support healthy brain function. Now remember, We need to locate and exercise the weaker lobes or areas of the brain. But in order to do this and not having the brain fatigue, proper nutrition will be necessary. So if you would like more information and you want to see what can be done to help your child, I am recommending that you call my office and schedule a $27 screening. During that screening, you are going to basically tell me what is going on with your child, explain to me the history of the problem, tell me what you have tried, what has worked, what hasn't worked. I'll perform a set of non-invasive tests to determine if your child has the potential to respond to my care, and I will answer all of your questions. The information from the screening will let you know if your child is likely to benefit from the care I have to offer. It's going to tell you what specific testing will be required to determine the, let's say, specific therapies and nutritional support, what type of care will be necessary to allow your child to reach their optimum level of physical, mental, social, emotional, academic, and behavioral level of performance. It'll tell you the cost of the care. The time we spend will tell us the expectations you should have as a result of the care I offer and what will be expected of you for your child to get the most out of their care. I want to get a thorough understanding of what is going on with your child. I want to see if this is someone that I can work with. And keep in mind that when I say I want to see if I can work with them, it has nothing to do with their, let's say, level of hyperactivity or aggressiveness. There are certain things that I am looking for that will let me know if I can have an impact on your child's life. So again, if you would like to schedule a $27 screening to determine what needs to be done for your child to reach their optimum level of physical, mental, social, emotional, academic, and behavioral level of performance, then be sure to call my office. I wish you, your family, and of course your child nothing but the very best.